I greet you again. I hope everyone is well. So we are in our second topic on health and wellness, and today we are going to learn about sexually transmitted infections. We find that sexually transmitted infections are a major health problem among the youth, and we shall specifically learn about the most common ones. These infections are many, but we are going to look at the most common ones. We are going to look at the causes of these sexually transmitted infections, how we can manage them, and also strategies as students and community to prevent the sexually transmitted infections. So some of the most common sexually transmitted infections are chlamydia, genital herpes, genital warts, we have gonorrhea, we have hepatitis B, and as you all know, HIV, which leads to AIDS, the human papillomavirus, which we call the HPV, which leads to cervical cancer. We have the pubic rise, we have syphilis, trichomonas, and vaginitis. These are some of the most common ones. So we normally say sexually transmitted infections, which we used to call sexually transmitted diseases previously. They are infections passed through sexual contact. That is including sexual contact through the vagina, the anal or oral sex. And they can be caused by germs like bacteria, viruses, and also parasites. Some of them are curable, and these ones include chlamydia, gonorrhea, and syphilis, while we find others, some of the sexually transmitted infections, especially the ones caused by viruses, are not curable, like the HIV virus, the herpes simplex virus, and the human papillomavirus. So we find people must first be infected before they have the disease. That's why we like calling them sexually transmitted infections, not sexually transmitted diseases. So for one to have an infection, it means, or when one gets an infection caused by a germ, this can cause illness in the person's body. So an infected person may or may not feel sick. A disease means that the infection in the person is already causing the infected person to feel sick or to notice that something is wrong. So we have said again, sexually transmitted infections are infections transmitted through sexual activity. So when a sexually transmitted infection is left untreated, it will lead to the disease with more severe consequences. So an example is like when we say HIV, that is the HIV, you have the infection, and then you can get the AIDS is when you get the disease. So they can be caused by bacteria, as we have said, and some of these things we have talked about. Parasites like trichomonas, viruses like the herpes and the HIV, and then we have the ones that are caused by bacteria like gonorrhea, the syphilis. So we've seen the curable ones and the ones that are not curable. Mainly we have said they are the ones that are caused by the viruses. So how can one know that you have a sexually transmitted infection? So we find the bad thing is that many of them don't have obvious symptoms. You may be sick, but you don't know. You have the infection, but you don't know, like the early stages of HIV. And we find that when symptoms do appear, actually they can include abnormal discharge. Then we have the genital sores or ulcers. There could be lower abdominal pain and also itching around the anal area or the vaginal area. So there are some complications. If one has a sexually transmitted infection and it's left untreated, it can cause some complications, and especially if you have untreated gonorrhea or chlamydia, one of the major complications is infertility. So as young people, if you get this disease and you're young, it's not treated, you may get infertility. Human papillomavirus can lead to cancer of the cervix and even other parts, as you'll learn as we go on. It then increased HIV risk. Having STIs can increase the risk of contracting HIV because now your body has lowered its immunity. Pregnancy complication is another risk, or pregnancy complications is another complication of STIs. And then serious health problems if some of these are left untreated. So how can we prevent sexually transmitted infections? You remember we talk of the ABCs. I know even in your school life, you were told about the ABCs of prevention. That is, we call them the safer sex practices. Safer sex practices, learners here, these are the practices that reduce the chances of getting an infection or a sexually transmitted infection. And in this case, of course, we start with the A of the ABCs, that is the A, abstinence. Yeah, for those who are not married, it's good to abstain from sex because if you don't get into sexual contact with somebody, there's no way you're going to get that infection. So for those who are married or with a serious partner, we say you be faithful, the B part of it, be faithful to one negative partner. So whenever we get a partner, it's always good to know the status of that person. And then the other thing is about using condoms correctly and consistently. This can prevent the spread of many sexually transmitted infections. Then we also say another prevention strategy is education, proper education about sexually transmitted infections, now together with the safer sex, the sexual practices. Then we have vaccines that can prevent some of these infections, like the hepatitis B virus, the HPV virus, which we find given in public hospitals for free, especially for young girls. So how do we diagnose the sexually transmitted infections? So there are screening, there are some screenings that can be done. So we recommend regular STI screening for sexually active individuals. And then the other thing, of course, there are those lab tests that can be done if one suspects that, or you feel uncomfortable, you feel as though you have the infection, go to the hospital and then they can do the tests. Then the treatment is use of antibiotics. This one can cure most of the bacterial and parasitic infections. Then antiviral medication can manage viral infections like herpes, HIV, though it doesn't cure them, but it can manage them. Then the other thing that we normally insist, and I still insist here, is that partner notification. So when you are diagnosed with a sexually transmitted infection, it's essential that you inform your sexual partner so that they can also get tested and also treated in case they are sick. So we find that the importance of a renewed commitment to sexually transmitted infection and control in achieving global sexual and reproductive health, that in STIs, we find there are many people who are infected by these STIs. And when we look at the statistics, people have so many with these diseases. So we need to control them so that we can reduce the burden of sexually transmitted infection, which is found to be going up, especially in the low-income countries. We find the consequences of sexually transmitted infections have a profound impact on sexual and reproductive health. You remember we have talked about even issues to do with infertility. And then it can also affect the unborn baby, which we call the fetal and neonatal deaths. These ones are common. HPV, that is the human papillomavirus, can cause cervical cancer. It has been found to cause in very many people. And then in addition, the direct physical, psychological, and social consequences of STIs have a major impact on the quality of life and a prime indicator of the quality of global sexual and reproductive health care. That is because of the sexually transmitted infections. So what we are saying here in summary, I'm trying to say that if you have a sexual partner, we have a mutually monogamous sexual relationship with one who is uninfected. And for one to know that one is not infected, it's always good to have the test. And then use the condoms properly. And then reduce the chances of getting HIV infection by preventing and controlling other STIs, because we have said when you're infected, you have a higher chance of getting HIV. So the other thing we need to do is that we need to strongly think about taking HIV prevention treatments. Like if one has, maybe you've accidentally been exposed to sex without your consent, or a risky, we call it a risky exposure, like giving an example like rape, we have medication that we can use which is called PEP, which is post-exposure prophylaxis. And the other one is what we call PrEP. PrEP is pre-exposure prophylaxis, that is taking medicine regularly to prevent HIV infection from possible future exposures during unsafe sex. So the other thing we encourage young people like you is to delay having sexual relationship as long as possible. So because we realize the younger the person is when they start to having sexual contact, the more susceptible they are to getting an STI. Then we have said it, and I'll repeat it again. Let's encourage having regular checkups for HIV and STIs. So concluding that, the expectations for this topic, let's do all the activities under this topic. There are discussions, there is a journal, and also there is a quiz. So remember to contact me in case you need any assistance. Otherwise, thank you so much for that, and enjoy the topic.